department at the Southwestern Area Agency on Aging. She has a focus on helping individuals navigate the complexities of Medicare, among many other things that she advises clients on. So welcome, Katie. And then finally, we have Melanie Lambert, who is a senior Medicare advocate for the Center for Medicare Advocacy, a true expert on the topic that we will be talking about. And welcome, Melanie. So let's jump right in and get started. We have some housekeeping, by the way, before we get into our specific questions. If you have questions, please post them, and we will do the best we can to answer as many of those questions that come into the webinar. We may not hit them all, but we'll do the best we can to hit as many as we can. Having said, let's get started. And Katie, I'm going to start with you. Some basic definitions. Medicare. What is Medicare and who is eligible to enroll?
Thank you, Rob. So Medicare is health insurance for individuals who are 65 and over, for individuals that are under 65 with certain disabilities, and then for individuals that have end-stage renal disease of any age.
Terrific. Do people need, and let me go to you, Melanie, do people need to sign up for Medicare? Let's say even if you're employed still, but you're over the age of 70, do you still have to enroll?
That's a great question. So folks who are turning 65, who are already collecting Social Security benefits, will usually receive something automatically notifying them that they're being enrolled in Medicare. They'll receive something in the mail, and they'll have to decline to sign up for Medicare Part B if they don't want to take it at that time. And folks who are still working, who have employer health coverage, will often delay their Medicare Part B. Most people will take Part A anyway when they're first eligible, which is hospital insurance, because most people who have paid into Social Security and Medicare for at least 10 years get Part A for free. But people do have to pay a premium for Part B, which is medical, outpatient doctor's visits, and other outpatient services, and that has a monthly premium. So folks who are still working when they turn 65 and work for a larger employer are often able to delay enrolling in Part B until that employer coverage ends. One important thing to remember is that employer coverage does need to be based on active employment. So if you have retiree coverage or COBRA or something that's not based on active employment, you are going to want to enroll in Medicare when you're first eligible to avoid penalties down the road.
Gotcha. Soraya, did you want to add something?
Just to want to add to that, active employment, as Melanie said, and also if you're married and one of your spouses is working and have coverage under the spouse's active employment, yes, the spouse can also be able to delay Medicare.
Yeah. I think for many, there's a confusion about Medicare and Medicaid. Let me start with you, Melanie. Can you just describe to the people tuning in, what are some of the basic differences, since Medicaid obviously is relevant for many seniors as well?
Absolutely. And some folks have both, and it can be very confusing. And folks often don't know what the difference is or what they have. Sort of the basic difference between Medicare and Medicaid is that Medicare eligibility is based, as Katie said, on either age or disability. So folks who have paid into Social Security during their lifetime are generally eligible for Medicare based on disability, certain disabilities. When people turn 65, they're generally eligible for Medicare, regardless of how much money they have in the bank. It's not considered a means tested program or something that is based on how much money you have or how much money you make. Medicaid is a means tested program, meaning that it is for people who fall under certain income and asset limits, income meaning the money you get monthly, assets meaning the money you have in the bank or other assets. So folks will qualify for different categories of Medicaid depending on what their income and assets are that fall under those limits. And some folks qualify for both Medicare and Medicaid, and they can sometimes complement each other and provide savings to folks who have trouble affording their Medicare.
Katie, on questions like this that come your way, are they typically coming from seniors themselves, or are they coming from family members, or is it some of both?
So I think we get a plethora of people that call. We do get a good amount of seniors that call themselves when they're first becoming eligible for Medicare, looking for some guidance, wondering the difference between Medicare and Medicaid. But we do get a lot of calls from family members, maybe that heard about some savings that their family member could have while on Medicare, or wondering if they're Medicaid eligible. So I would say it's a good mix of both.
So Soraya, I'm looking your way, and of course on a personal level, and you and I have had conversations about my 95-year-old mother. And boy, is it complex when those come through, whether it's seniors, let's say seniors in particular, through the municipal agent program. How are you able to guide those seniors through this really complex issue?
It's well, I'm choices trained, and Katie can mention something later on about choices, and that had helped me. It's a tool for me to be able to help and provide unbiased information to each senior. Each case is different. I usually tell people that contact us for information about Medicare. Every case, every situation is different, and it's good to always find the help. Find like here in this area of Fairfield County, we have SWACA, the Choices program, that they can contact. Here in Norwalk, people have learned about us here, and they usually contact me for that. And it's on case by case because each case is different. As you mentioned, your mom's, and your mom is had a very particular situation that we had to explore and investigate and find out information. And for each senior, it's different because they also usually when I'm talking to someone, I try to screen for programs that I may qualify for, and like the Medicare savings programs that we probably later we're gonna talk about more about that.
Gotcha.
If I could just add on to
Yes.
what Soraya was saying. So I am the choices manager and regional coordinator for SWACA. So within the southwestern region of the state. So like she was saying, every Medicare situation or path is usually unique. So we always recommend reaching out to the choices 1-800 number, or all of our senior centers either have a choices trained counselor that is trained to provide unbiased Medicare information, or if they don't have a choices trained counselor, know how to get in touch with us, have a direct contact with me. So we can look at your particular situation, do a full evaluation of what your needs are, and point you in the direction of the correct and most appropriate plan, and give you a guidance on what your mapping is going to be to get on Medicare.
Just to add one more thing, usually people will say, but I talked to Social Security, and why is that they didn't say this to me? And unfortunately, Social Security won't give you detailed information or specific information to your situation. They're just there to sign you up for Medicare.
Gotcha. So, Katie, you just mentioned the Choices program, and it sounds
Yes.
like that's a vehicle to really essentially kind of determine what your choices are and maybe to make
Absolutely.
some decisions. I'm aware, based on my own conversations with Soraya, that again, once you get into this, there's a whole list of letters, Medicare A, Medicare B, Advantage programs. It becomes overwhelming.
Absolutely.
And
Yeah.
so,
That's what we're here for. That's what choices counselors are there for, to make it less overwhelming. You're right, there are so many different letters, there's so many different options you have. And so we use a plan finder and tools to really pick apart your situation to see what option would be best for you.
gotcha. Now, there are, and I'll throw this to you, Melanie, but please, Katie and Soraya jumped in. There are deadlines, right, for enrollment and more importantly, re-enrollment, correct? And I'm going to assume that for seniors, they really have to be on top of them or have an advocate to make sure they don't miss these deadlines. Is that correct?
Yes, absolutely. So there's your initial enrollment period when you first become eligible for Medicare, and for most folks, that's going to fall around the 7 months surrounding their 65th birthday. So it's the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after. And that's when most people will initially enroll in Medicare. Um, Folks who still have employer coverage through themselves or their spouse will have a special enrollment period to enroll later that will last for 8 months from when that employer coverage, again, based on active employment, ends from them or their spouse. And that's for enrolling in Medicare A and B. And that's something you need to do whether you decide to do Medicare, traditional Medicare, which is just Medicare A and B through the federal government, or Medicare Advantage, as Rob mentioned. So either way, you're going to have to do that initial enrollment into Medicare. But then you also have this annual opportunity called open enrollment to make changes to the way you get your Medicare, your Part D, if you want to change your Advantage plan, join an Advantage plan, things like that. You get an annual opportunity to do that between October 15th and December 7th of each year. And those changes will go into effect January 1st of each year. So, and then there's also a whole bunch of special circumstances where if certain things happen, you can qualify for other special enrollment periods. Um, eh, if you are leaving a planned service area, for example, if you move, if something with the plan changes, sometimes there are special enrollment periods for people who are losing Medicaid, for example. There's a lot of different special circumstances that can allow someone to make an enrollment change outside of that. And I did see that there was a question about folks who, just explaining a little bit more for folks who have both Medicare and Medicaid and how to get that. So in Connecticut, Medicaid is called Husky. And I know Katie and Soraya were talking about the Choices program. And while the Department of Social Services administers the Husky program and Medicaid, and we'll talk about some other cost assistance programs that help Medicare beneficiaries, a lot of folks, when they have Medicaid, they don't realize they have to sign up for Medicare when they become eligible. And that kind of transition is something that Choices helps with and does a really fantastic job of helping people to understand how to enroll in Medicare and also how their Medicare and Medicaid work together so that their costs aren't super high because there are ways for that to be brought down for those folks so that the costs are manageable.
Yeah. So Melanie, you mentioned cost and Katie, and then I'm going to ask you also, Soraya. Cost is not an insignificant issue, is it, when you're talking about making choices about what kind of coverage? So, because all of these options have different cost pieces, is that correct, Katie?
Yes, yes. So there is, again, that's why, Melanie was talking about the open enrollment period, from October 15th to December 7th. We always recommend everybody evaluate their choices. Again, I believe Part D prescription coverage is one of those big factors that comes into play. Certain Part D companies or plans may cover one medication fully. Another company may not, or may only cover part of it. So we have seen, we can save people thousands of dollars when they reevaluate in that open enrollment period between two different prescription drug plans. And we've seen a significant amount of savings in between.
Interesting.
Just to continue with what Katie was saying, for example, there is a prescription drug plan. If you have it in 2020, if you had it in 2024, and maybe that company that you had, your Part D prescription or plan, maybe the following year they decided not to cover one or two of your medications, and they will send you a letter, I think around September, October. But most of our people don't pay attention to those letters, and they realize that they have to pay out of pocket, probably full price for the medication the following year when they go to the pharmacy. That's why it's important to, as Katie mentioned, to revise your coverage between the open enrollment, between October 15 and December 7th.
I just want to add to that, we mentioned the open enrollment from October 15th to December 7th. There's also a Medicare Advantage open enrollment period that we're actually in right now, that comes every year from January 1st to March 31st, where if you're currently in a Medicare Advantage plan, and let's say you're in the situation Soraya just mentioned, where most Medicare Advantage plans have a Part D component to it, and let's say you went to the pharmacy and your drug costs were higher than you expected because you didn't notice that letter you got back in October, you do have an opportunity right now to change to a different Medicare Advantage plan or to a standalone prescription drug plan, which would put you back in traditional Medicare. So if that situation applies to you, call choices.
So you raised the Advantage plan, and I think that in my own learning, certainly I got some sense of that. But can you say a little bit more about what, as you just said, Melanie, and please, Katie and Soraya, jump in. There's the traditional Medicare A and B, but then there's Advantage. So what's the difference? What's an Advantage plan, and why would somebody choose to take advantage of an Advantage plan?
Sure. So when you first sign up for Medicare, like I said, you're going to want to enroll in Part A and Part B. And Part A and Part B are what are referred to as traditional Medicare. And like I said, you sign up for this either way. You get a red, white, and blue card in the mail that has your Medicare effective dates and your Medicare number. That covers hospital. Part A covers hospital inpatient to a certain extent. There is cost sharing. There's no premium for Part A, but there is a deductible for hospital admissions, and there can be significant cost sharing for hospital and other inpatient stays like skilled nursing facility stays. With Part B, you get all your outpatient services, and in general, Part B, you have your monthly premium, and then you are paying about 20% coinsurance. So that can get very expensive if you just have Part A and Part B, right? And there's something called Medigap, which I know we're talking about Medicare Advantage, but it helps to sort of explain the compare and contrast, at least the way it works in my brain. So there's also something called Medigap, which is a separate policy someone will buy if they have traditional Medicare, A and B, to cover that cost sharing that A and B do not cover. So it'll cover those hospital deductibles. It covers additional hospital days. And it covers generally that 20% coinsurance for Part B and a lot of that cost sharing. Then someone in traditional Medicare would also generally want to purchase a standalone Part D plan to cover their prescription drugs. So if you're on the traditional Medicare side, you've got your Part A and your Part B on your red, white, and blue card. You might be buying a Medigap policy as a standalone to cover that cost sharing. And then you've got your standalone Part D. The Medigap and the Part D and the Part B all have their own premiums, and you're buying all of these separately. So it's a lot to figure out. It's a lot to navigate. There's a lot of options. And I would say in general, not as a rule, but in general, it can be more expensive up front because you're paying probably a higher premium on all of those things. That being said, if you have a really comprehensive Medigap plan and let's say a really um, uh, robust Part D plan, if you end up using those benefits, you might be paying not very much or zero, right? So very low cost sharing, especially if you have a really good Medigap plan. Now on the Medicare Advantage side, what you're getting is you're getting your A and B through a private company. And it works like most of the health insurance that we all have through our employer or through a marketplace or something where it works like a managed care plan. So you might have an HMO or a PPO where you basically have a network of providers that you can see. In traditional Medicare, you can see any Medicare provider. In Medicare Advantage, you are staying within the network of providers generally. So whether you have it through Anthem or Aetna or Cigna, you would go through their network, United Healthcare, et cetera. And a lot of these plans have a very low premium or a $0 premium. So they can be very attractive for that reason. They usually include Part D, so it's one-stop shopping. You just get your Medicare Advantage plan. You don't need to buy that standalone Part D. You don't need to get a Medigap. You're probably paying less upfront, and you get extra benefits that Medicare does not cover, like dental, vision, hearing, things like that. Sometimes gym membership, sometimes an over-the-counter benefit. There's a lot of very attractive things that come in these Advantage plans. That being said, when you use your benefits, depending on what the service is, and again, this is a generalization, just sort of describing some of the difference. So in traditional Medicare, you might be paying more upfront, but you might be more covered when you go to access your benefits. In Medicare Advantage, you're paying less upfront generally, but when you go to access your benefits, you might be paying more. The maximum out of pocket, I don't know exactly where it is right now, but I'd say it's somewhere around 9,000, Katie and
Yeah.
Soraya, for a year, for what you would pay out of pocket for medical. With Medicare Advantage, you also have more claims review, things like prior authorization, a lot more management that goes through the plan. Whereas with traditional Medicare, you don't really have a lot of that utilization review and things like that. And if Medicare pays, the Medigap always pays. So it just kind of depends on the person's situation, their budget, what their priorities are. And I would also say, like, if you're really interested in those supplemental benefits, you want to make sure they really cover what you want. So if it has dental, make sure, is it a cleaning and an x-ray or is it a comprehensive dental benefit? Things like that. So make sure you're getting what you want out of your supplemental benefits. And I think I've said enough about that. So Soraya and Katie, if you have anything to add.
I think I have to second to what you're saying, Melanie. I think we see a plethora of combinations of people choosing traditional Medicare or a Medicare Advantage. We have a counselor that is actually a choices trained counselor. His wife is on a Medicare Advantage plan. He is on a Medigap and traditional Medicare, loves it. She loves her Advantage plan and takes advantage of every single benefit that they offer. It met her needs. She definitely did her research on what, the dental services would cover, what vision services were actually covered. She does like a step competition where she gets an extra benefit from that. You really, some people see a great advantage in those Advantage plans, and some people the Medigap or in traditional Medicare is just a better option for them. I think it really differs, but I think the most important part is if you are going to choose to get on a Medicare Advantage, is to make sure that you do your research on exactly what those extra benefits are going to cover. Dental, vision, and hearing is most important.
It's interesting as you all speak, and I'll throw it to you, Soraya, but please, all three of you comment that a critical decision point in terms of what plan to go with for seniors is how much they want to pay on a monthly premium to get maybe a more extensive amount of coverage with no worries, as opposed to a much smaller monthly premium where there could be some upfront money that maybe you're not even aware of. And I'm guessing, and Soraya, again, I'll throw it to you, but please, Melanie and Katie jump in as well. That's got to be challenging for seniors who, generally speaking, are on a fixed income. So they want to do everything they can to keep their monthly costs down. But on the other hand, they also want to make sure that their health care is covered as much as possible. Is that something that you hear coming your way, Soraya?
Yes, very much. And just to kind of continue, but also just to give you an example, like in everything, there are pros and cons on both sides. You know, either if you go the original way or the advantage way. That's why we people on Medicare, they need to do the work. That's why choices exist. But for example, let's say that someone it's people tend to go the new to Medicare, the ones that are healthy, they tend to go the advantage way because they see that it's a 0 monthly premium plan, but they still have to pay the 185 for Medicare Part B premium. And that advantage plan could be if their health it's okay, they only go to see their doctors 2 or 3 times a year, that is probably a good option. But I've seen over the years when, let's say this person has the advantage plan, but all of a sudden is diagnosed with something, a chronic illness that requires to see a specialist. So that 0 monthly premium plan and maybe paying $20 for primary care physicians or 40, 50 for a specialist, all of a sudden has to see different specialists, has to therapies and things like that. So those co-payments will be, if they're specialists, $40, $50 every time they visit someone. And that plan, the 0 monthly premium plan, is starting to look more expensive by the day as they need to go access more providers. So they usually that's when I usually see that they tend to go look for information on the original Medicare. Go back to a straight Medicare Part A, Part B with a prescription drug plan and a supplemental plan. Or if they qualify for the Medicare savings programs, that's an option that we can probably talk a little bit more about the Medicare savings programs in detail. But there are pros and cons with everything, and it depends on someone's health is at that point that they decide to make changes. I don't know if you
So,
guys want to add.
yeah, well, and just as a follow-up, and Katie, I'll throw it to you. I mean, I'm just taking a step back and thinking of a senior who is struggling with a lot of issues, maybe health, maybe financial. My gosh, the role that all three of you play, it seems to me, is so critically important because just the sense of a senior being totally overwhelmed by all of this.
It truly is. It's very overwhelming. When we provide a one-on-one counseling to a beneficiary, to a senior, we strive on doing a full evaluation of how we can help at all. So let's start with maybe what your monthly income is, see what programs you might qualify for before even moving on to what options are best for them. It is a struggle, and I have to agree with Soraya. A lot of the times when people have more medical needs, traditional Medicare and a Medicare supplement are a good choice for them. But again, there is definitely more of an upfront cost with that. So that's why the Medicare Advantage is appealing. And I know we kind of had it on the agenda later on, but if I can just introduce everybody to the Medicare Savings Program, if that's okay.
Yes,
So the Medicare Savings Program is something we, as choices counselors, evaluate every single person that we speak to about. If you make under 42, so as a married couple would be under $4,336 a month. And then as a single person would be under $3,209 a month. That is including Social Security, any type of income you receive at all. You would qualify for the Medicare, or you should qualify for the Medicare Savings Plan. It does not take assets into account, which is something to keep in mind, because Medicaid does. And with this Medicare Savings Program, there's a few different levels, but at the, at the lowest level, when you're at the highest level of income, it would at least, the state would pay your $185 a month Part B premium, which for some is a big savings. I've spoken to many beneficiaries that didn't know about the program, were paying the $185 a month and maybe paying $200 a month for a supplemental plan, that are saving $400 a month, which is life-changing for some on a really fixed income. If you are on the lower end of the income spectrum and you apply for Medicare Savings Program, it would also cover your Part B deductibles, co-pays, co-insurances, and qualify you for special prescription coverage, which with lower co-pays. So it is truly life-saving and life-changing for some of these seniors that are on a fixed income. If you think you might qualify for it, if you think a friend might qualify for anybody, please just send them to the Choices 1-800 number, and we could just evaluate you and see if it's something that might benefit you. It's a very simple 3-page application. It's as easy as it gets. And we field everybody for it. If you call, we're going to field it for it no matter what, because it's such a big savings.
Wow. Wow. That's a huge benefit. It sounds from what you're describing.
Yes.
Wow. Wow. And that information can be obtained by simply calling the 1-800
Yeah.
Choices
Call on the
number.
1-800 Choices number. We can give you all the information you need for it, mail you out an application, assist you with, applying if you need it. I know Soraya, I'm sure, does many Medicare Savings Plan applications a day, probably. So any of our Choices trained counselors are very familiar with it, and many of our just, people that work at the senior center or at the libraries are really familiar with the program. So please just call our 1-800 line or reach out to your senior center to get more information.
Rob, if you, I just wanted to add to what Katie was saying, that the Medicare Savings Programs, there's a second part to it. I usually say, you apply for one, but you get 2 benefits. It's, here in Connecticut, you're automatically enrolling the Extra Help, also known as the low income subsidy, which this helps reduce your premium or eliminate your premium for your prescription drug plan, your Part D, and also makes your copayments for medication to no more than it's $12.15 for brand medications and $4.90 for generics. So it's like you apply for one, you get help with your Part B premium, 185, and also for your prescription drug plan.
Yeah. It occurs to me as we're talking and the complexity of all this, and hugely important, the information that you all provide. Melanie, I'm curious, in your role, how important do you think it is to have for a senior, a family member, an advocate, if you will, to help a senior kind of navigate this beyond what you all provide? How helpful is that to the process?
Well, that's a great segue into what the Center for Medicare Advocacy does, actually, because I know we've talked a lot about choices, and I come from the choices world and cannot say enough good things about the work that the Choices program does. And I know Lindsay just dropped the 800 number that Katie was referring to in the chat for everyone. The Center for Medicare Advocacy is a nonprofit, nonpartisan law organization that has been here in Connecticut since 1986, and we provide assistance to Connecticut Medicare beneficiaries mostly with Medicare appeals. So if you are ever denied coverage from, let's say you are, it could be something as simple as a prior authorization denial for a service, or it could be something like you or your family member in the hospital or in a skilled nursing facility and you're being discharged and you think it's too early. So anything where you think Medicare should be covering something and it's not, that's when you want to call us and see if it's something where we can assist. And we assist from everything from just simple piece of information over the phone to, in some cases, legally representing folks in their appeals, depending on the situation. And as far as your question, Rob, with, having an advocate or someone to assist, um, I think that can go a long way. I mean, not everybody needs it. It kind of depends on the situation, but I think especially for the kind of cases that we handle where it can be a very fraught situation and maybe someone's being discharged from the hospital or trying to get home health care and are being told that they don't qualify for physical therapy anymore because let's say they aren't improving anymore, which just so you know, you don't have to be improving, you can still get it covered. Um, all these things are, it's exhausting. It's absolutely exhausting for folks to deal with. It's confusing. It doesn't matter how smart you are, how savvy you are. It is a labyrinthine process to get through the appeals process, understanding all the different rules and regulations that go along with Medicare. And that's why programs like Choices and why organizations like the Center for Medicare Advocacy exist to help beneficiaries navigate those issues and walk through them. So if you have someone who can, help you even take notes and help gather that information, that can be enormously helpful to a lot of people. Yeah.
So Melanie, you said something that really caught my attention because, you know, many of us, maybe some on this call, have had relatives who have gone to rehab and have in fact heard, well, you're not progressing and the coverage is not going to continue. So you said something a little different.
Yeah. So, and I should be, I'll try to be more clear here. So it depends on the type of service.
Mhm.
So for something like skilled nursing, that actually that would still be the same. So for something like skilled nursing, there's a bunch of nuances with getting skilled nursing care, especially if you're going there from the hospital with Medicare. One of the big things that people don't know or that people get stuck in is that there's a requirement if you're going for an inpatient skilled nursing facility stay that you have 3 days or really 3 midnights in the hospital before you go into the skilled nursing facility for original Medicare to cover that stay. Now, most
Mhm.
Medicare Advantage plans waive that 3 day requirement, so that generally only applies if you are in traditional Medicare. But that is something we see, and it's called observation status. When someone's in a hospital receiving services like an inpatient, but they're not actually admitted, they're on observation. Sometimes people get stuck in there, and um, one of the things the center has done around that is litigation to try and get appeal rights for observation status. And we recently won appeal rights for a small group of folks who were switched from inpatient to observation without getting in the weeds of everything. Um, uh, but the bottom line is even people who work for hospital providers, skilled nursing providers, ambulance providers don't always get the rules right for Medicare. And the thing about improvement is one of those areas. There was another issue that the center litigated um, to um, to help get the Center for Medicare and Medicaid Services to clarify that you do not need to be improving to qualify for medically necessary care. So if you're in a skilled nursing facility or you're receiving home health and you've plateaued, you're not getting better, that is not something that means Medicare cannot cover that service. It's very clearly written in the regulations and in the guidance that you do not have to be improving. You do have to need medically necessary skilled level of care, which means if you're in a nursing facility, you need daily nursing or physical therapy 5 times a week is considered daily, things like that. So there are still a lot of rules around what you have to qualify for, but you don't have to be improving. Um, it can be just to, for example, keep you from losing function. That would be enough reason. As long as a doctor is certifying or other provider is certifying that it's medically necessary and that it meets the skilled care requirements, you can still qualify for coverage.
So you mentioned something, Melanie, and I'll throw this to you, Katie. Um, Providers, and that many providers, hospitals and such, maybe don't fully understand themselves the rules. And I know that can have a real impact on a senior who may need to go from a hospital to some type of care afterwards. And there appears to be a real knowledge gap there. Have you found that as well?
Yeah, absolutely. We speak to beneficiaries often that the provider or the person that's doing the billing for the provider are just uninformed or unsure of the answers to those questions. You know, even just simply sometimes with the Medicare savings plan having billing issues, you know, not billing it correctly. We see that oftentimes. We always recommend people contact us, or they can contact CMA, you know, and we can advocate for them, try to get them the correct information, help them start the appeals process, because it does happen often, and it's very daunting for seniors. If you ever feel like the information they're giving you, or maybe that the doctor or the provider are uninformed, please just reach out to us, because oftentimes they are. Some are fabulous and really understand the rules and regulations really well. But sometimes they're just not educated enough. There are a lot of rules and stipulations and policies, and you know, so it can be very confusing even for the providers. So we always recommend, you know, reaching out to us if there's any, if you're questioning anything at all.
That's great. That's great. So Soraya, you know, we talked a lot about the different plans and the complexities in your role and as the municipal agent for the elderly here in Norwalk. How often do you have where a senior comes in is just so overwhelmed that they say, oh, in effect, to heck with it. I'll just go with whatever. And do you find that you have to really talk them through that process?
Yes, it's often, and some, you know, they're learning that we're here to also help here in Norwalk as a municipal agent, and it's often that we get seniors like that, and they one of the, I just want to add here, one of the common things that happen is that they have something that is working for them. Maybe they have a plan for years. Let's say it's an advantage plan, and all of a sudden they go to the supermarket and they find someone there that it's a broker that it's offering them something different, and they start by asking questions, and all of a sudden they get in the mail a new car for a different plan, and they go to see their doctors and things like that. The doctor usually wants, very few will probably want to accept that, or the X medication is not being covered. So that's when they start looking for help. That's when they usually will find us or will find choices. And we need to talk to them. We need to usually one-on-one counseling as choices counselor. We try to educate our seniors for them to in the future when they encounter these vendors or brokers, so they can advocate for themselves, so they can say no, I can listen to you, but do not change my plans. That's one of the most common things that I see, you know, on a weekly basis.
Yeah, and I'm not surprised. I've actually heard that from a family member as well, where there are supposed great deals out there to lower cost and give more service. Melanie, Katie, does that come your way too? I mean, we're talking about people who are salespeople, who are,
Absolutely.
right?
Yeah, oh, absolutely. And I, you know, I do have to say on the flip side of it, there are some brokers that are fabulous and really are looking out for the best interest. It's possible, but for the most part, I think, you know, just they're trying to sell maybe just one or two specific advantage plans that may not be beneficial to that specific beneficiary. Oftentimes I hear people call us and they're like, well, my neighbor is on this plan and they said I should switch to that. And I'm like, no, okay, well, we have to look at your specific situation. Their situation is probably very different than yours. Doesn't mean it's going to be more beneficial for you. So I think it's just so specific to person by person. Because we get those calls a lot. My cousin's on this plan. She said I should really switch to it. sometimes the cousin's in another part of the country, or, you know, it does happen often. I don't know if Melanie, if you want to add anything.
No, I think you covered it. Yeah, I think that really hits the nail on the head that one of the great things about choices is that they're able to provide comprehensive information on every plan that's available with no concern from the beneficiary that they might be steered towards a particular plan because it has a higher commission or financial incentive. The choices folks don't receive any commissions for enrollments. Um, they're able to give that unbiased information to beneficiaries and can assist with the enrollment if they like, or they can do it on their own. And yeah, it's really a wonderful option for folks to have and to be able to get that comprehensive information on every plan that's available, um, based on what they're interested in, and not have to worry that you're going to be steered into something that might not be best for you.
And then the challenge is if you have been steered into something that may not be the best, how do you get out of it?
So I know we mentioned before those special enrollment periods,
Yes.
and so that is something that I know Choices sees a lot, is folks who, for various reasons, whether they were confused or they were pressured, or um, there's a lot of different situations where folks end up in a plan that they didn't mean to enroll in. And a lot of times choices can help get them access to a special enrollment period to either get back into the plan they were in before or to enroll in a different plan, depending. Um, I don't know, Katie or Soraya, if you want to add to that.
Yeah, I was gonna say, we do see that often. We just tell them to reach out to us, where they either got steered in the wrong direction, maybe kind of got coerced into signing up for the plan. Like Melanie was saying, our biggest stance is we provide that completely comprehensive, unbiased information. Does not matter to me which company they go with. We try to make sure the beneficiary understands exactly how that plan works. All of my counselors that work in-house here within SWACA, we either email, plan details, so that way they can see it in writing, mail it to them, or if they're in person, really go over it well before we feel comfortable enrolling them in a plan. We want to make sure that they've done their research as well as us providing that information to them. But we do see it often, where they're, made the wrong decision, close into it, or just, you know, uh, made the wrong choice, and we can always help, try to assist them get into the
That's
correct
great.
plan.
So there really is an outlet,
Yeah,
a way
yeah,
out, so to speak.
Absolutely, yeah, yeah.
We've been talking a lot about all of these different complexities of Medicare and A and B and Advantage plans. Is this uniform from state to state, or are we really talking about Connecticut? I mean, how does it, is there any variations if you were to go to Massachusetts, for example? Would it be very similar?
It's funny that you say that, because I was just thinking, oh, we're almost out of time and we haven't talked about how great Connecticut Medigap is
There you go.
specifically. And so that's a great opportunity too. So a lot of it is consistent state to state, like traditional Medicare, for example, is the same anywhere you go. And that's also something that often factors into people's decisions of which to choose, because you can take traditional Medicare and Medigap with you throughout the country. Um, your Medicare Advantage options and your Part D options are generally specific to where you live. So there's different plans available in your service area. That being said, some do have national networks so that you can also take those with you when you travel. It just depends on the plan, and that's something you should certainly look into when you're selecting a plan. But two big differences for Connecticut that I want to mention are Medigap and the Medicare Savings Program that Katie talked about. So Medigap in Connecticut is like the best in the country, in the sense that in all but 4 states in the country, if you don't choose Medigap when you first become Medicare eligible, you lose your ability to either purchase a Medigap policy, or you get charged a higher rate, and you're subject to underwriting down the road when you go to purchase that policy. Connecticut is one of 4 states where we have ongoing guaranteed issue, meaning that you cannot be denied a Medigap policy, and you also cannot be charged a higher rate. Everyone is charged the same rate regardless of health condition. For folks under 65, they can't, they're restricted to certain plans that they can purchase, but they're still charged at the same rate as everyone else. Community rated guaranteed issue, ongoing enrollment. Yeah, so you can enroll at any time, you can switch at any time, you can take it with you. If you are planning to move to another state, make sure you buy that Medigap policy before you move, because you lose those guaranteed issue rights after you move, but you can take it with you as long as you keep paying the premium. And then Medicare Savings Program, you know, Katie mentioned the income limits before and that there's no asset test. That piece is specific to Connecticut. We have much higher income limits here than in other states, and most other states do have an asset test and a more sort of complicated process to apply and to qualify. So in those 2 respects, I would say our state is different. And there is I know Soraya already put in the chat that there is a SHIP program, or the equivalent of choices, in every state in the country. And you can find yours on shiphelp.org, but I know Soraya already put in the Massachusetts one, which is SHINE. So there's a program in every state to help folks navigate these complex processes.
Wow. Well, that's great. And thank you. Thank you for noting the importance of the plans that are unique to Connecticut. I mean, that's really great. We literally have just a couple of minutes, and I just want to make sure that throwing it out to the 3 of you, if you have any closing comments you would like to make to the people who've Zoomed in today. I will tell you what an incredible wealth of information and what an incredible group of people to be resources to the people who really need this information. But any closing comments that any of you would like to make on behalf of the work you do to the people who are Zooming in today?
I just want to add, well, I know we've said it many times, if you are new to Medicare, have any type of questions at all, don't hesitate to reach out to our 1-800 number or your local senior center. Even if you've been on a plan for 10 years, again, that you love, it could change. Also, our 1-800 number, we do also provide other senior resources. We oftentimes are kind of the first stop within SWACA. If you are in need of home care or any other senior resources, we try to provide do a full evaluation and provide any resource that's possible. We oftentimes have people call us, with the questions about Medicare and maybe food banks in their area, or, we try to do a real thorough evaluation and provide anything that's possible at the time. So if you have any other senior community resource questions, or really any other senior questions, please feel free to reach out to us as well as the Medicare piece.
Terrific. Soraya, anything you would like to share as a closing comment?
Sure, thank you. If you're in Norwalk, if you have family relatives here in Norwalk, please reach out to Family and Children's Agency, Senior Services. We're here to help our residents, and always look for help. Usually when I talk to different places or with clients, I usually say, this might not apply to you, but here's information, because you have a neighbor, you have a friend, a relative that might benefit from this.
Terrific. And Melanie, closing us out with any comments, suggestions you'd like to make?
Sure. I just wanted to say, the 800 number for choices. You can also reach the Senior Medicare Patrol through that number, which I know we talked about folks getting enrolled into plans that they didn't choose, and other forms of fraud, or situations where, hey, this is showing up on my Medicare summary notice and I didn't get the service. You can also contact the Senior Medicare Patrol for any suspected fraud. And please contact us at the Center for Medicare Advocacy. We also answer questions around what Medicare covers, enrollment questions. We do some out-of-state assistance. It is mainly for Connecticut beneficiaries, but we can often answer questions for out-of-state as well. And Yeah, it was a pleasure to do this presentation, and thanks for having me.
Melanie, Katie, and Soraya, I cannot thank you enough. I mean, I started by saying we have a true expert group of panelists, and you have proven that 10 times over. And I think everyone who's tuned in, I'm sure, has learned something. I have learned a lot, and I cannot thank you all enough. For our audience, through email, you will get contact information. Some of it will go out so that you'll know and be able to reach the various ways that have been identified, whether it's choices, some of the other advocacy things. So stay tuned and look for that information that will be sent via email. And keep in mind that we will be doing this again. This is our third year of providing these virtual conversations on topics that we really feel are relevant to the larger community. And boy, did this fit that critical definition today. So thank you all, our panelists, and thank you all for tuning in. And we'll
Thank
see you
you.
again.
Thank you.
Thank you.